Joining us now to talk more on the current state of diabetes care in Canada is Dr. Seema Nagpal, Vice President of Science and Policy for Diabetes Canada. Ma'am, welcome to Forum Daily.
Thank you.
So let's start with a quick overview of what exactly diabetes is and how it has affected Canadians throughout the years.
Yeah, it's really important to understand what diabetes is. It's a disease that's well known, but not known well. Type 1 diabetes is a disease in which the pancreas doesn't produce enough insulin. The cause of type 1 diabetes is pretty much unknown. What is known is that it is not caused by eating too much sugar or any of the myths like that. It isn't preventable. Researchers do believe that type 1 diabetes occurs when the body's immune system destroys the cells that produce insulin. And that's a little bit different than type 2 diabetes, which is much more common. And that's when the pancreas either can't effectively use or produce enough insulin. And that's what occurs in about 90 to 95% of Canadians living with diabetes. And unfortunately, there's a stigma and a perception that type 2 diabetes is really a behavioral problem or a lifestyle choice problem. But the cause of type 2 diabetes is really complex. It's a complex interplay of genetic, behavioral, and environmental factors.
And it's believed 1 in 3 Canadians are living with diabetes or pre-diabetes, and in some cases they might not even know that they have this condition. So what are some identifying symptoms of diabetes?
That's right. It's really underappreciated, I think, that diabetes can occur without a health crisis. And so people don't always know to talk about these things with their doctor, and therefore their doctor isn't able to help them manage the condition. So some of the symptoms that people might experience is an unusual thirst, frequent urination, weight change, a sudden weight gain or weight loss, extreme fatigue, blurred vision. And as you can see, these symptoms aren't very specific. They could be a result of a few different things. So any changes in your health should really be discussed with your doctor in order to really tease out what's going on.
And we mentioned that the number of people with diabetes is expected to rise in Canada. Why is that, doctor?
Well, I think that's a good news, bad news story. The good news is that people living with diabetes are living longer than they ever have. So when we count the number of people with diabetes in Canada, those people are still in the count. So that's great news. The bad news is that more and more people are becoming diagnosed with diabetes. And so that's the thing that we really want to address. And understanding that complex interplay that I referred to of environmental factors, behavioral factors, and genetic factors is something that we really need to tease apart and understand a bit better. And then start to target those problems, whether they're societal or system problems that occur that allow us to be more sedentary and less active through our day, that actually encourage us to be less physically active, and those things that kind of force us or encourage us to eat in unhealthy eating patterns. We know that we're bombarded with messages to eat high energy foods with low nutritional value. We're bombarded with easy, fast food. So we really need to make some societal changes to make sure that living in a healthy way is the easy path, not the most difficult way to live.
All right, ma'am, just about 45 seconds left here, but what kind of steps can our officials take to improve diabetes care in Canada?
I think that one of the things that we really need to do is take a comprehensive look at the things that we can do to prevent and help people manage living with diabetes. And that's going to require kind of all hands on deck, from individuals knowing the risks and taking steps to reduce their own personal risk, but as well governments to change the environment in which we live. So it's actually not a disease producing environment, but a health producing environment. And we've talked to the federal government now a great deal about a diabetes strategy, a pan-Canadian diabetes strategy that looks at all of the ways that governments, federal, provincial, territorial governments can help to create a more health producing society.